But Sandhya J, the Group CFO at Narayana Healthcare, joins in on the show right now to talk about their recent acquisition. Sandhya, hi, good morning. Great to have you on the show. And I understand that you're joining in from Bangalore. Firstly, tell us, hope everything's okay. We are watching right now, live visuals coming in, incessant rains.
Yes, I think more than the rains, the inability to manage the water is the bigger problem. But I guess Bangaloreans are getting used to this. Yeah, good morning to everyone. Thank you for having me here.
You should take a leaf from us Mumbaikars. We see this every year. But tell me, let's talk about the new unit that you acquired. What is the payback period that you're expecting for this deal, and whether it's going to be margin and EPS accretive from the word go?
Yeah. So, if you would allow me a minute, it may be useful for me to set a little
Sure.
bit of context before we get into the deal itself. So, Health City, as many of you are aware, started as a cardiac hospital 22 years back. And at that point in time, around 2006, the Spurge unit was set up in Health City as an orthopedic and trauma center. So over the years, the Health City campus has expanded significantly. We have advanced capabilities in cancer care, neurology, neurosurgery, nephrology, gastroenterology. We are one of the largest bone marrow transplant units in the country. We are a preferred center for solid organ transplant like liver, kidney, lung transplant. We also have advanced robotic capabilities. We also are Asia's largest and most advanced cancer care center with a high-tech stem cell research center. So with all of this in place, the only piece which we were missing was orthopedics and trauma in that campus because Perch was already operating. So therefore, with this acquisition, we are able to bring together NHS capability to scale and Spurge's leadership that has got established in terms of orthopedics, and therefore create a holistic service offering to our patients. Now coming to your question on financials, the Spurge is already a well-run, profitable hospital. Our Health City is also a profitable unit, as you are aware, you've seen from our results. So I think this now with Spurge coming in, it will subsume into our Health City numbers, and we will be able to maintain our current trend of profitability from a Health City point of view. And as far as the payback is concerned, it does meet our internal IRR return thresholds.
Morning, Sandhya. Nikunj also joining in. Good to have you on the show.
Hi.
Your earlier
Hi.
guidance was 1,000 crores. Have
Yes.
you used this acquisition, and is that the guidance which you provided for has been used and the kitty is over? Or this is a surprise acquisition where you were just able to do something and that guidance is separate?
This was always in the work. So when we guided 1,000 crores, we also said that we will be looking at a few inorganic as part of that, and this is one of it. The cost of this asset is about 200 crores for the asset per se, and then we have done a small structuring with an OCD about 80 crores. So if you look at our Health City plan, we do believe that we will be making significant investments into our Health City campus, and this is part of it, but we would have more investments going into the campus.
I've had the pleasure of tracking NH for years now, even though when it was not listed. And I've always admired their low cost model. But of late it seems to be changing. And this acquisition, in a sense, looks like there is a differentiated strategy. Is my observation right?
So keeping the cost minimal for the patients continues to be the objective. But what we are also starting to realize is that we have to cater to all patients, patients who need a certain cost threshold to be able to afford treatment, but patients who can afford the treatment and who are looking for more quality, more facility, more look and feel. So we are looking at both ends of the spectrum from our capability point of view. The clinical outcome will remain same across the strata of the patients we serve. Of course, the patient experience and how we work with patients in terms of maybe the size of the room, or could be different for a patient who comes on a say a private ward versus a patient who comes on a general ward. So we are straddling across the pyramid, but it is very important for us that we do not lose our core value, which is that we have to provide healthcare for all and affordable healthcare. So that will always continue to steer and guide us through this journey. So this acquisition, definitely, if you look at it as a standalone orthopedic hospital, the valuation comes slightly at the higher end of the spectrum. But if you look at it integrated into the art of the possible and what we've been able to deliver in the Health City campus, I think it's a reasonably well-placed acquisition, even from a cost dynamics point of view.
How are you funding for this acquisition?
So we are funding through a bank a loan subject to the margin money, and the rest of it we would be funding through internal accruals.
Good morning, Nantara joining in from New Delhi. Now, we've of course started to see consolidation in the healthcare space. Here is one acquisition by you. Other chains are also doing it, whether it is a Fortis, whether it is a Max, even an Apollo has done it. Is this the way you see the industry progressing? Do you expect even the next year to be the one of consolidation? And the trend does seem to be, to pick up these smaller, distressed specialty hospitals.
Sure. So I cannot comment for the industry or others, but if you look at our stated strategy, we are not on an acquisition drive. We've clearly said that we want to strengthen our footprint in East and South. We want to make it stronger. So we would do investments, both inorganic like this, as well as greenfield investments in these two geographies, which is mainly Calcutta and Bangalore. There would be other areas where we would, if at all we would make investments, we would make them based on the return on capital employed and absolute merit of the business case itself. So we are not on an acquisition drive or to create a huge footprint, and rather we want to focus on our cash flow generation capability and return on capital. The second aspect is that just to take a step back and comment on the industry, I think there are certain merits and demerits to going into these small boutique investments. Sparsh is not a distressed asset at all. It is doing very, very well. There is a strategic synergy because of which we have taken. But in general, the advantage of taking these distressed assets that they may come at a cost, but then the initial working capital cycle and investment cycle over the first few years is exceptionally intensive in these assets. The second piece is that if you want to maximize your return on capital employed, then you have to root for scale. When you have, so when we go into a smaller asset, then you don't get the kind of scale that can give you that kind of returns that you are expecting. And also from a cost point of view, if you want to play as much in the value segment as much as you want to play in the premium segment, then it is important that you have the scale to be able to deliver the right cost equation. So we will not actively look at acquisitions of distressed assets, but we will make tactical choices as we go along the way.